now turn up.
Alright, this is Dr. Marcus with Summit Chiropractic. I am practicing in Albertville, Minnesota. I'm here to react to Dr. Joseph Ciprianos. He adjusts his wife. I think his wife is mamacip. She gets her back cracked is what the video is called. I see that he's already got this black box utensil. I know he's very famous for the Y-strap adjustment.
We got the massage guns in.
Let's see.
I want to go through. I just wanted to show everybody when you purchase a massage gun.
So I'll walk you through exactly what, a lot of times, what a chiropractor's thought is through this. That's a pretty cool gun.
The massage gun.
Looks a lot like the therapy gun.
You got the charger.
Oh.
Here, you've got all the different tips. So you got a total, you got 1, 2, 3, 4.
So it's pretty standard when it comes with therapy tools, is you get about 4 or 5 different tips. You get like a pointer, you get a prong tip, which I like using along the spine as a chiropractor. He said he likes to use it on big muscle groups, so there is a thicker utensil for that.
It's
a pretty loud tool compared to some of the, I like the Hypervolt. There's also the
second
Gun Pro 2 gun. There's some of their therapy guns that are a little bit quieter. I like quieter, so that I can at least talk and walk patients through.
Angles, depending on
the different angles are nice for some of the guns. I'm waiting for the adjustment part. All right. Hopefully time for adjustment time. Usually adjustments only take, I mean, for him and his wife, it probably takes like 60 seconds. So I'm assuming, since it's like a 7-minute video, that it's not going to take much.
Today,
she's pregnant.
Set my wife in here. It's been a minute since, well, not really since you've been adjusted, but since you've been recorded.
Yep.
While being adjusted. Now, obviously, even me being your husband, babe, how far along are you?
Get with the game, man. A week over 7 months.
Okay, I knew you were around 7 months.
So yeah, pregnancy and chiropractic, super safe.
7 months.
Oh, you want to be in the video too?
And we're due mid-March. So
yeah, so chiropractic and pregnancy, super safe. We're just trying to, a lot of times, align the pelvis for the birthing process. Try to get the baby to have that pregnancy be comfortable. We're trying to signal certain nerves to help with hormonal issues. Sometimes it's just pain and discomfort through a lot of the pelvic region. Also, when women's bodies are changing, of course, they're going to gain more weight in the front, and that's going to kind of pull them forward. And then also after pregnancy, when we're talking about breastfeeding and stuff, chiropractic is very good for those things. And we see a ton of that in my office as well when it becomes either newborns or pregnant women.
You know, lay face down. I don't on this table, but
a belly hole?
Yeah, it's got a belly hole. Yeah,
I mostly start people on their back as well, so I can see.
Stand up for me.
That'd be a good idea to have people start on their backs. It's easy. Oh, he's just going right at it. There we go.
Just take those off.
That's called the kitty pop. That is actually an adjustment that is called literally the kid pop. And why they call it the kitty pop is because a lot of times kids that don't have comfortability, they like looking at you while you do it.
Elbows tighter, 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 tighter. Good.
Oh yeah. Okay. It's just a general mobilization through the back, kind of using gravity to, of course, decompress some of that area.
I'm gonna
have you sit
on the table. One leg on either side for me, please. One hand over each shoulder for me.
There are so many different techniques with chiropractic. Some of these techniques are very rarely used, and some of them are used a ton.
Yes. Oh my gosh.
That's a response a lot of times people will have. They're like, man, why have I not done this sooner? And of course, she's probably getting adjusted regularly, of course, being a wife of a chiropractor.
Okay. Take a deep breath in and out.
So as you see, a lot focused through the mid-back so far. Oh yeah. That's one of my favorites, just because you're using gravity, you're using the body weight, and it just never, it just right in the middle, always needs to just be decompressed, mobilized. A lot of times it gets stuck through there, and I mean, she's probably getting adjusted pretty regularly, and if somebody's not, oh yeah, here we come, the Y strap. Oof.
Deep breath in and out.
It's a good idea to have people take a couple deep breaths. Try to, even her being a regular, just needs to let that thing settle.
How'd that feel?
Really good.
Good.
Yeah, I bet.
It's been a minute.
I know, it has been.
Too long.
I love the pull adjustment on me. I usually get it done manually by hands on myself, but this is just a different way of doing it.
Really loose.
Yeah, I would say
main
so.
one Was that seated lumbar.
The seated
That was
lumbar.
Amazing.
So you're kind of really loud with that tool, which right now he's just kind of working through some of those muscles that might be a little bit angry after all that mobilization. It's good to just loosen up those muscles to make sure that that adjustment's staying where it should be. And getting those segments aligned, we just want to make sure that those muscles are then going to respond properly. Just working through the rhomboids, traps. He's working kind of on the outside as well. Usually I don't work through the lat, especially with pregnant ladies, but I mean, he's working through rhomboids, low trap, kind of right around the spine there. It's kind of why I like that prong thing. Utensil, I think that's a little bit more effective and efficient, but everyone's a little different. Right? Going right through the SI joints, those are areas that if they get locked up, they'll cause some sciatica. In fact, a lot of times I'll even try to go work through a little bit of the glute, which he didn't in this case, but I bet if I watch a future video that he would probably have some sort of working through the
Guys, well,
glute.
that wraps up today. So my wife's channel, mamacip, she actually does a lot of the compilation videos that you see here. So we have thousands of videos out there, and a lot of times on the compilation videos, I mean, it gets a lot of patients that may have not even came out on my channel, but they do get brought out on your channel.
Mm-hmm.
So we got all the compilation videos.
I do it for the crack addicts, you know.
And then I know you also have fun with our trips to vacations and like to put things up as well.
Yeah, I'll
too,
put up
so.
random little videos throughout, whoever's interested in seeing the little trips that we do and whatnot.
So yeah, that's a pretty
Everyone, we wanna wish you happy
standard
holidays.
adjustment
Have a
sequence
great
that
year.
I'm assuming that he goes through, and probably a standard adjustment sequence that a lot of chiropractors go through. So overall, what I'm going to be doing is I'm going to be doing a little bit more reaction videos to these and walking you through step by step what a doctor, a chiropractor specifically, thinks about when they're walking through this and why he's doing certain things. And in her case, she's a pretty normal, probably a normal person with spinal wise, just because she gets adjusted regularly. There's nothing of like, I know he has where, oh my goodness, this person's been suffering from migraine for 20 years. Well, then I can walk through a little bit more in depth of what that reaction would look like and why he's doing certain things, because some people just want to just hear the cracking sound, stuff like that. Apparently they have crack addicts. But I'm just here to give you a little bit different perspective on it too. And then I'll have some other videos as well. So subscribe if you like the reaction, like or comment if there's a Dr. Joseph video that you would like me to react to, and I can go back. If there is no one that comments, then I'm just going to keep going forward with his new videos that keep coming out. Since this one came out a day ago, it already has a bunch of views. All right, so this is Dr. Marcus with Summit Chiropractic. We'll see you next time.